I suppose some of the social workers in mental health trusts, there may be very few senior managers who are actually social workers. So thinking about where they get their reflective supervision, their social work supervision, was very important. So I'm glad to see that's been really incorporated in the new document. It's been a culmination of a lot of work. There's been a lot of conversations, there's been a lot of discussions and workshops. The Principal Social Work Network has been very involved and supportive throughout. Diversity and leadership, or the lack of inclusive leadership, has been something that's been at the forefront of the Adults Principal Social Work Network for the last couple of years, I would say. The PSW role is supposed to be a role that champions social work leadership within each organisation, but it wasn't really reflective, or it isn't really reflective of the workforce or the communities in which we support. Now, our workforce is very diverse, but higher up you get within the organisations, it's not very reflective. We know that it's not inclusive, but what are we going to do about it? And let's have an opportunity. Let's have the conversations. We've already had those now, but now what are we going to do about moving this forward? Last year we had a really very powerful workshop, and that really showcased the research that Karen Lind and Roger Klein had been doing. It also highlighted some of the research that the Principal Social Work Network had been doing. So one of the things that we've been looking at is really succession planning and talent spotting. You know, you will have the same type of leadership if you're always looking in the same type of places. But how can we encourage people to step forward and take the opportunities that are out there for those roles if they don't necessarily feel confident or comfortable stepping forward into those leadership roles? For me, the Principal Social Work role is key, and the more visible diversity and inclusiveness that role is, I think it would raise the aspirations in social workers coming up. There's a clear career pathway, and if they identify with people at the top of that pathway, then they can see themselves in those roles. So there's been very many research and articles and different journals around the more diverse a leadership board is, the more creative, the more solution focused. You're having different ideas. It's not just one perspective that's being discussed or being pushed forward. You're having the different experiences of everybody in that board, and that can only mean a better thing. Successful organisation, a successful board, successful business. Our business is the business of supporting people, and for that to work successfully, to have a fully inclusive and diverse leadership team, and not just racially diverse, but inclusive across the board, so representative of people who have disabilities, of gender, across the board, it can only mean for a better, successful organisation. The voice of social work hasn't necessarily been enabled to be as loud as it could or should be, but in recent years, so in the past few years, we've seen a change. We've had more senior leaders who are social work qualified, and that's really starting to make a difference. As I said, that there are mental health trusts where perhaps there are senior leaders there are few social work senior leaders, but then there are also a lot of mental health trusts where there's some really good work, some innovative work going on. And this is an opportunity for us to showcase that good work, because then we can share the good practice, we can share the knowledge, and we can model good future ways of working. I'd like to take forward that social workers are being heard, those in integrated settings, in particular in mental health social work settings and mental health trusts, that they're really being heard, that we listen to them when they say the things that are important to them are good reflective supervision, being able to spend quality time with families and with individuals, to really practice relationship-based and strengths-based interventions, to be able to influence the organisations that they're working in, and to be truly person-centred.